The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back, Shifties, to the next episode of the Shift podcast. This is going to be a really interesting, exciting, collaborative episode. I'm so thrilled to introduce my next guest. Geoff he and I met actually via podcasting and the work that we both do in the healthcare space. And it's really fascinating. I have to really say thank you, Geoff, along the way for all of your support. A big fan of healthcare, worked in healthcare for a while. Then your wife became ill and you were on the other side. So we're going to talk a little bit about that. But first, Geoff, I'd like you to tell the Shifties just a little bit about you. I want you to explain your role in healthcare and then talk about the moment that everything shifted. And I did that on purpose because I want you to tell the name of your podcast. So I'm combining your podcast and this podcast. So take it away, Geoff. Thank you so much for being here.
Oh, thank you very much. I'm honored to be here. I know most of your guests are nurses. I am not a nurse, but I am the son of a nurse, and I'm the nephew of four nurses. So I've been, seeing healthcare through the caregiver's eyes since I was a little boy. But my business is really, I have 25 plus years in human capital management, specializing in employee engagement, leadership development, and culture change initiatives in the workplace. But my last 10 years has been 100% dedicated to the healthcare industry. And I like to say in many industries, employee engagement can be kind of quote unquote a buzzword. But in healthcare, it's a necessity for optimal patient outcomes. And one of my major shifts really came when I started to look at my own business through the patient's eyes, as you referenced during my wife's battle with cancer. I don't think I understood the importance of my own work until I came at it from the other side. I saw firsthand her hang on every word and instruction of the nurse that made her laugh and coincidentally tune out the physician that wouldn't even make eye contact. So,
Yes.
But it all came to me in a moment where everything made sense and really drove my shift towards being more purposeful. And I was doing the part of my job I loved. I was doing an all-day workshop around leadership development and employee engagement at a 25,000 plus academic health system in my backyard. And we were bringing in different parts of the organization throughout the day, OD and LD for 90 minutes, nurse leadership for 90 minutes, C-level. And when we got halfway through the workshop, we broke for lunch. And coincidentally, both fortunately and unfortunately, my wife is 800 yards away in the cancer center being prepped for a bone marrow transplant. I say fortunately because we have that wonderful system in our backyard to care for her. But unfortunately, obviously, she was going through it. And as I walked into her room, her nurse had her arm around her and my wife was crying. And I ran over and I said, "Why are you crying?" And she said, "Because Gloria didn't bring me my lunch today. Gloria sings to me when she brings me my lunch." And it was just this really powerful moment because here I am talking to the CNO, the CHRO, the CEO of this large health system about how employee engagement impacts patient outcomes. And a food service employee is uplifting my wife as she fights for her life. And it just, when I went back to the next session, we started talking again, and there were actually a couple detractors from the health system that were saying, "I like a lot of these ideas for our nursing staff, but I'm not sure how we scale it across the organization." And I just raised my hand and I said, "Hey, could I tell everyone a story that's like 45 minutes old?" And the tenor of the meeting changed. It changed from whiteboards and PowerPoints to true human connection and how every touch point at a healthcare system has the ability to create extraordinary human experiences.
And Geoff, I love that so much because that's the reason why I started the Shift podcast. Everything you described is in that moment, there's a shift and you experienced it, the shift from someone really being attentive to your wife, the shift from really understanding the role of the nurse, the role of the person that delivers the lunch. There's so many roles in the healthcare system, and they're all equally important, and they all create a shift. And we as humans have the ability to make that shift happen. And that's the power.
And in healthcare, it's different. I've had the privilege of working with one of the world's leading researchers on people, performance, team dynamic, and engagement at work. And he talks a lot about dynamic teams. And in healthcare, it's very different. All of those team members that don't tree up to a traditional org chart, they're working together to provide the extraordinary human experience. I would be on one floor, and it just felt different than if I was on another floor. And I always used to, because this was my business, I used to go up to the team leader, who is generally the de facto team leader, is always the nurse leader on the floor. And I would go up to her or him and say, hey, it just feels different on this floor. What do you do? And I remember one time that nurse on the floor with Gloria, the food service employee, said, Geoff, we teach everyone here to lead with compassion. And it actually brought me, because I had access to that health system and was working with them and was working with the CHRO, I went to him and I said, hey, I want you to do me a favor. I know this isn't how you traditionally measure it, but I want you to pull the HCAHPS and employee experience scores on one floor. And he came back to me about a month later and he said, Geoff, through the roof, how did you know? And I said, I felt it.
Yeah, so you teed me up perfectly for this, and you didn't even know you did it. As you know, SC Healthcare sponsors this podcast, and SC Healthcare is a software as a service, laser focused on clinician burnout. And one thing that our company does is we're able to measure and monitor burnout. We are able to identify root causes to burnout down to the unit level. And when units are burned out, and I'm going to ask you if you're able to recognize this, but when you have a unit that there are people in that environment that are burned out, you can hear it, see it, feel it in the culture. And so I kind of want you to describe the difference between some of those units where there was that culture and they led by compassion. And then what did a unit, or did you ever experience a unit that you were like, bet you their HCAHPS scores aren't where they need to be. I bet you their quality is not where it needs to be. I bet you their engagement is not where it needs to be. And was it burnout? Because you feel it.
Yeah, so obviously I've seen both sides. But the one thing I always like to say, especially to, an audience of caregivers, nobody got into the healing arts because they weren't purposeful and passionate and wanting to make the world a better place and heal. But the broken systems in healthcare do drag that purpose out of them, over time, and create burnout and all of these things that bring them away from the original purpose of why they wanted to heal people. And one thing I teach in healthcare is, you mentioned it, at the unit level. And I love what you guys do at SC Healthcare. I am a huge fan of your pulse check, real time measuring these things and giving actionable data. Because what I talk to healthcare systems about is, when we measure things top down, we truly have nothing to take action on. When we measure employee experience at an organizational level, it doesn't mean anything. There's nothing to do with that information. But when we measure bottom up, you mentioned by unit or by team, where the work really happens, we can create actionable insights by seeing where the pockets of brilliance are in a healthcare system, where it is being done right. And then we just answer one question and one question only. How do we make more teams like our best teams? And when we measure it properly and measure it in those smaller increments that we can do something with in real time, I say to healthcare executives all the time, do you take the pulse of your patients once a year? Then why the heck are we doing it with the most critical workforce on the planet?
Wow, that's really powerful. And in our work at SC Healthcare, we're seeing more and more clinicians talking about burnout. We believe that we're helping people create an environment of awareness. It shocks me when I speak to people, and I've actually spoken to a CNO or two or three that have said burnout. We don't have any burnout in our hospital. My nurses are not burned out. And I say, really, how do you know that? Have you ever measured it? So to your point, when things are meaningful and when things matter, you have to measure it and you have to monitor it. You have to keep your finger on the pulse and not just once a year.
You have to measure it in the right way. You have to measure it with the right questions. For example, um, people are very poor raters of other people. I've seen the research on that. For example, those CNOs that told you, "Oh no, we don't have a burnout problem." There's bias involved. There's all kinds of things. It's why performance reviews don't work, because they tell you more about the person doing the reviewing than they do the person being reviewed. But when we ask the right questions, one thing people are very accurate raters of is how something makes them feel. So when we ask the right questions about burnout, about engagement, about whatever the case may be, we always know we're getting 100% accurate answers if we're asking how something makes them feel. And burnout is a feeling. Burnout is real, and there are too many organizations. I always like to say, healthcare is at the forefront of clinical innovation, yet lags 30 years behind the private sector in people strategy. I know manufacturing firms that invest more in their workforce than many healthcare systems. So the idea is we have to find a way with products like SE Healthcare and many other purposeful products that are investments in the most critical workforce on the planet to show healthcare administration that these investments are not nice to haves. They are must haves.
They are must haves because I say this all the time, Geoff. The people, the KPIs, the key performance indicators, those are driven by the people. And if you don't keep your people involved, interested, and inspired, you're never going to move the needle on the most important metrics.
And it's also fascinating, and I do this on a daily basis. What's really encouraging is all the science and evidence-based research backs up just being more human.
You're right.
So it's always great when I can connect the dots for healthcare organizations to say, hey, I want you to measure it on that floor, because I knew the answers to the test before he even pulled them, and teach them if we can measure it that way in real time and provide actionable insights, then we can scale. We can scale that across the organizations, because when we find out where our high performing teams, where the pockets of brilliance, where outcomes, engagement, HCAPs are all better, we also find where the best team leaders are, right? We find where our best nurse leaders are, our best leaders, and then we can model it across the organization by learning from them.
Right. And it's all about adopting best practices and just making those adoptions that are going to move the needle and highlight all those pockets of brilliance you keep referencing.
Yeah.
In your experience, when your wife was in the hospital, could you quickly recognize some of the behaviors of burnout?
You certainly could. I think it's more along the lines of, once again, when that purpose is stripped out of you by the broken systems, you tend to see an attitude around checking the box. They're trying to get through their day versus be authentically present with each patient. And you can see that. And I could also see when there is burnout, there is also a lack of engagement with my wife. I remember there was one nurse that just was a check the box. I viewed her as a check the box nurse. She was showing up for a paycheck, and as soon as she was done, she was out. When my wife came home from chemo, where that nurse was caring for her. I always asked, okay, what are we doing next? What's the next step? She goes, oh, I don't know. Because that checked the box also translated now to the patient and not listening as well.
Well, and you teed it up perfectly again, because when your care providers, the people providing care, aren't engaged because maybe they're exhausted, which are all signs of burnout, what happens is the patients aren't involved in their care and they get readmitted. And it's this big snowball that is not good for anybody. And in healthcare, when we sign up to take care of people, that's what we're signing up to do. And it's difficult when you have people in the environment that some people are given 100% and some people are given 50%. And that's the other part that starts to burn out, because why am I working this hard if this person isn't working so hard? And all this disengagement in the clinical care delivery environment equals bad things.
And as I mentioned before, it's not sinister. You know, sometimes my wife will get upset about the care she gets from a certain doctor or nurse or whatever. And I said, listen, we don't know what we don't know.
Mm-hmm.
You know, I know the systems those people are working with are awful. I know that there is burnout out there. We don't know what they're going on in their personal life. So just be, you know, compassionate and understand that every person that got into that industry is a purposeful person. It's just the system has taken out. You referenced my podcast. My podcast is named Moments of Experience. And I bring on world's leading innovators on employee experience, which is my business, caregiver experience, which is yours, patient experience, and just plain human experience, which is all of our business. And they talk about the moments that shaped them, that moved them, and inspired them to pursue purposeful outcomes in healthcare and beyond. And one of the themes when I have doctors and nurses on, it's not the moment they share is never the original connection to purpose. It's always the reconnection to purpose after burnout, after, you know, disengagement, after having the systems stripping away their joy. What was the moment that the aha that connected and said that, yes, this is why I got into this? And it's amazing to hear those stories.
It's amazing. And those are the moments of the shift. So I'm combining our podcast.
Yes.
And it's so funny that you say that, because that's my story. Same thing happened to me. And that's what made me shift and reconnect to my purpose.
Yeah. And my shift, when I left that day where I the food service and singing food service employee and talking to the CNO and the CEO saying, I had no idea these things go on in my health system. I have to see this. That's what started my shift. A few months later, I had this high-paying, cushy corporate job, and I realized only about a third of my job was impacting outcomes. And I woke up one morning and I just resigned. I had no idea what I was going to do next. But I knew I had to, 100% of my efforts had to be towards impacting those that both provide and receive care. I was shifting to 100% focus on patient outcomes through caregiver experience. And I just started winging it. And I collaborating with world's leaders in nursing, clinician, burnout, frontline well-being and mental health, caregiver engagement, patient experience. And for the last 2 years, I've been working on amazing collaborations with all of these people. I mean, I've done everything from helped build a model of love and compassion that can be delivered to a healthcare system as systematic change. I put aside more than half of my week every week to work with purposeful nurse and clinician entrepreneurs and led businesses on a pro bono basis to help take their wonderful product and idea after they've shifted from the bedside to making true impact and help them take that wonderful idea to market. And it's just been meaningful, impactful, purposeful. cathartic, rejuvenating. But I can tell you my shift is still in process. I'm still searching for kind of the full-time, I'm all over the place and I'm loving everything I do, so I wouldn't change anything. But ultimately, I want to find a full-time home where I can make the biggest impact.
And I think that's what everyone wants to do. They all want to find their purpose and follow their passion. And I'm just going to say, I have to tell you, you're passionate, you're on purpose with purpose. And I so respect and appreciate all your advocacy for any clinician. You do great work. The podcast is great. I mean, I'm so thrilled that somehow our universe is connected and collided, and it's been wonderful. Geoff, at the end of every single one of my podcasts, we leave the shifties with a couple nuggets or a couple things to think about. And if you could just give the shifties a couple things to think about that are, boom, like powerful, can you share them with us?
Yeah, so I'll start with a question. I want everyone listening to really think about this. Have you ever found something bigger in your life without walking through a phase of uncertainty first? I believe, especially in shifts, uncertainty can be empowering. Uncertainty can be a lot of things. It can be scary. It can be unnerving. It can be stressful. It can also be empowering, exciting, and lead to growth and breakthroughs in careers and lives. So uncertainty can be empowering is one thing I want to leave everyone with, because if you are going to make that shift, I've made multiple shifts in uncertain times. And I remember the first time I left the corporate world, because I've done everything from work for the corporate industry leader to building my own entrepreneurial startup from the ground up. In my first shift to running my own business, 6 months later, after just taking a shot, I was in a boardroom with Mark Cuban in a real life Shark Tank well before there was a television show. So I have never found anything bigger in my life without walking through a phase of uncertainty first. So embrace that.
That's a great takeaway. So, Geoff, thank you so much for joining me. I want to encourage everyone to watch his podcast as well. And shifties, I just always say this to y'all. Remember, your shift makes a difference. Keep shifting. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.